Before I had my surgery, I had constant heartburn and a great deal of coughing. I'd wake up at night with a lot of reflux in my mouth. Sometimes I thought I was going to choke before I could sit up. And it was very, very uncomfortable. Constantly eating Tums or antacids or drinking club soda to see if I couldn't cool the heartburn down.
Gastroesophageal reflux disease is a complex disorder with the basic manifestation being heartburn or pain, chronic coughs from reflux acid, gastric contents, into the esophagus. The esophagus has a special lining, but it is not the same lining as the stomach. The stomach lining is formed to protect from acid injury. The acid or the bile that's in the small bowel that refluxes into the esophagus causes a burn, causes injury, and that's the problem. The pulmonologists are becoming more and more aware that patients reflux at night. They reflux their gastric contents into their lungs, and this causes chronic lung problems. In the past, patients have been diagnosed as having asthma or reactive airway disease, and what we're finding out is a large number of these patients are refluxing, asymptomatic refluxers of gastric content.
Since the operation, I just feel wonderful, and I haven't had any discomfort. The reflux is completely gone, and it's just been an amazing turnaround.
I'm so glad I had this operation. Since I've had it, I've had no chest pains, no indigestions, I sleep good at night, and everything as a whole is just great. I wish I'd had it 20 years ago.
Well, the surgery has accomplished things that the medication could never do, and it has corrected the reflux problem and the hiatal hernia, and just, I can't say enough good about the operation. It's just been a godsend.
The months before my operation, it just got to a point in my life where I just didn't want to eat no more. I wouldn't say that I didn't want to live no more, but if I could have lived without eating, I'd have been happy. But after the operation, I hadn't had one bit of that trouble.
I know that really you can't tell how bad someone is feeling inside. Of course, I felt like I knew. Being married to someone for almost 47 years, you feel that you know everything about them. But I thought I knew how bad he was feeling, but I really did not realize what he had gone through until he was himself again after the surgery. And then I knew that he had to be in terrible pain. Only then could I realize how bad he had suffered before.